Hello everybody, today I will be discussing about Ciclesonide. This medicine may be familiar to those with asthma. It is good to know that there are different kinds of medications for asthma. As you can see, we have bronchodilator drugs, which is a medication that makes breathing easier. We also have the controller or preventer medication. This reduces the inflammation in the lungs, preventing asthma symptoms. We can see here that inhaled corticosteroid is highlighted, and that is because Ciclesonide is an inhaled corticosteroid. Just an overview, inhaled corticosteroid is known to be the most effective anti-inflammatory drug for asthma, as this works by decreasing airway obstruction. Drugs under this type also prevents the late-phase inflammatory response and decreases bronchial hyperreactivity. Now let us talk about the medicine itself, Ciclesonide. Ciclesonide is indicated as a prophylactic and maintenance treatment of asthma and COPD. COPD is a common lung disease causing restricted airflow and breathing problems. Now, it is important to note that Ciclesonide is not indicated for the treatment for asthma. Rather, it works by simply decreasing the number and severity of asthma attacks. So how does this drug work? Ciclesonide is a prodrug that is converted to its active form M1 or Ciclesonide in the lungs. This acts as a human glucocorticoid receptor agonist. Its anti-inflammatory actions contribute to its efficacy in asthma. Ciclesonide decreases airway reactivity to inhaled allergens as it inhibits the increase of inflammatory cells, known as total eosinophils, and inflammatory mediators induce sputum. Let us now talk about its pharmacokinetics. Ciclesonide has a systemic bioavailability that is estimated as 50% or more through inhalation, and through oral, the systemic bioavailability is less than 1%. Now for its distribution, as this drug is an inhaled corticosteroid, it has a high deposition in the lungs. Protein binding becomes very high with a 98 to 99% once it enters the systemic circulation. As I've mentioned earlier, Ciclesonide is converted to its active form M1 in the lungs, and this is done by an enzyme called esterase. M1 has a much higher affinity, and it involves cytochrome P450 to produce hydroxylated metabolites. For its elimination, Ciclesonide is mainly excreted in feces and has a half-life of 3.5 hours. Next is its pharmacodynamic. Once Ciclesonide is inhaled, a major fraction directly deposits in the upper respiratory tract and is deposited in the lungs. Now, via the pulmonary absorption, the drug enters the systemic circulation, leading to its potential systemic side effects. On the other hand, a large fraction is deposited in the mouth and pharynx. The deposited fraction is washed off by rinsing the mouth with water. However, the fraction of the drug remaining in the mouth may be swallowed, which then undergo the gastrointestinal absorption. As it goes through the gastric absorption, the first pass metabolism in the liver inactivates a fraction of the absorbed drug, and the remaining drug reaches the systemic circulation, which then causes the systemic side effect. What are Ciclesonide's adverse effects? I chose to mention 5 specific adverse effects because this may be considered concerning and may need a doctor's consultation. These are visual disturbances, sinusitis, anxiety, insomnia and mental depression, bronchitis, and upper respiratory tract infection. Other adverse effects such as dry throat, hoarseness, and bad taste in mouth are considered usual adverse effects. Some important points to know when taking this medication is having to regularly clean the mouthpiece and making sure you have and follow an asthma action plan from the doctor. This includes the patient not reducing the dosage or stopping the medicine without letting the doctor know. And lastly, it is important for the patient to rinse mouth with water after taking this medication. Now for the dosage, adults can take 80 to 320 micrograms, while for children, it is 80 to 160 micrograms once daily. Now for the interdisciplinary team, Ciclesonide belongs to Schedule 4 or prescription-only medicine. This means that this medication can only be purchased with a prescription prescribed by a doctor, nurse practitioners, or midwives. Lastly, some precaution. For COPD patients, this may increase risk of pneumonia. And for smokers, this medication may respond less and may require a high dosage. And lastly, Ciclesonide is safe for breastfeeding mothers. To end my presentation, here are 2 questions to test your knowledge about Ciclesonide. Thank you so much for listening to my presentation and have a great day.